systemic scleroderma or systemic sclerosis. It's name of one disease, but it will be correct. You will be right if you say sclerosis or scleroderma. Systemic scleroderma or sclerosis, it's the same disease. It's one type of connective tissue disorder. One big type of disease of connective tissue disorder. And why this disease called systemic? Cause mainly a general process which affected by this disease will be all system. It little bit look like SLE, systemic lupus erythematosus. If you remember, students, in SLE, patient bodies affected in 90% common. In common situation, they will be affected 90% of internal organs, skins, joints, you know about this. In systemic scleroderma, also 90% of the body of patient will be affected by this disease. That's why when rheumatology you will found name of disease like systemic, it means will be big change of body. It's first, and as usual, this disease also autoimmune cause disease. Second slide. With multi-system disorder, I already said about this. In SLE also was multi-system disorder, dysfunction of internal organs, and this disease also will be characterized by this multi-system disorder. And mainly problem, there will be functional and structural abnormalities of blood vessels. This disease characterized by the abnormalities of blood vessels. Due to these functional and structural abnormalities of blood vessels, will be fibrosis of skin and internal organs. That's why I said, that's why I said there will be general process, general change. Common disease will be affected 90% of body. And as usual, there will be activation of immune system cells due to autoimmunity of the patient genetic problems. Okay. Okay. Now, in epidemiology, what will be in epidemiology? 75 cases per 100,000 case of all population. More affected female as usual, all rheumatological disease affected except gout arthritis and ankylosing spondylitis affect female. Age 35 to 65. Of course, genetic predisposition will be present for patient with this disease. And as usual, there will be infection factors, mainly viral infection. Due to persistent presentation of viral infection, there will be changes and damaging of the blood vessels, small blood vessel, and that's why there might be activation of immune cells. And one big trigger factors, you should know about this occupational factor. Mainly this disease affect a person who work in factories with some chemical agents, and mainly high percentage of these chemical agents, silica dust. For example, which type of the chemical agents might be reason trigger factors which activate immune cells in patient with genetic predisposition? Might be silica dust, organic solvents, urea formaldehyde, polyvinyl chloride, bleomycin, L-tryptophan, etc. Like this type of chemical agents might be activated, triggered patient with genetic predisposition. What happens when a patient with genetic predisposition with HLE gene disorder plus external trigger factors activate immune cells. They will be activate as usual T cells, which activate like Langerhans cells, macrophages, but you should understand that target of this aim of these cells, inflamed cells, which want to be protect something or start inflamed process in some specific place, will be small vessels and arterioles. That's why the first clinical manifestation start from the derma skins, because as you know, derma skin will reach from small arterioles and vessels. At the same time, there will be humoral immunity activate, which produce high level gamma globulins in blood. You can find hyperglobulinemia, and as a result of the inflamed cells activate T cells, Langerhans, macrophages, always activated B cells, which produced autoantibodies. T cells always responsible for activation of B cells, which produced autoantibodies. Here will be a high positive percent of the ANA, anti-nuclear antibody, will be positive in 95%. If you remember, in SLE also will be very high specific to anti-nuclear antibody, and especially about drug-induced SLE. If you remember, previous lecture I said about this. And producing of antibody, producing of anti-nuclear antibody will be a next step to the performance of the antigen-antibody complex, which start accumulate and which start depositing small vessels in internal part, in the tail part of vessels, and will be reason of the big changes. What happened when there will be accumulation of this complex? There will be endothelial cell injuries because inflamed cells come to this place and start attack. Then there will be adhesion and activation of platelets, and when they will be adhere and activate thrombocytes, of course the size of the arterioles decrease because inside part will become to inflame and it's decrease in diameter. And due to this start vasoconstriction, growth, and later due to the growth, they start fibrosis, because this growth also happen due to fibroblast activation. Fibroblast activation always will be responsible for fibrosis of endothelium. But except this, you should understand that there will be a high production of collagen, fibronectin, and glycosaminoglycan. These three intracellular matrix will be responsible for fibrosis of tissue. First, fibrosis of skin, fibrosis of arterioles, and due to this result, fibrosis of skin and internal organs. And when they happen fibrosis, start some specific symptoms which are responsible for different organs, and a clinical manifestation depend from which organs already have been affected, and there will be fibrosis. Fibrosis in common all systemic scleroderma, you can tell that there is one big word which can characterize all this disease. It's fibrosis. Fibrosis of the endothelial part of small vessels, fibrosis of skin, fibrosis of internal organs. Fibrosis will be some fibrosis happen time by time. Inflamed cells working, immune cells activated. As usual, activate antibodies, macrophages, T cells. As usual, start inflamed process. Due to inflamed, always might be vasoconstriction and growth of endothelial cells. But here, there will be also high fibroblast activation and activation of extracellular matrix, collagen, fibronectin, and glycosaminoglycan. That's why there will be fibrosis. Okay. You can tell pathophysiology like this: primarily immunological way or primarily ischemic. There might be different trigger factors. If primarily immunological, sorry, in office, 1 second. Hello? Okay. They might be a two-way, and if they will be primarily immunological, of course, they will be responsible immune cells which are activated due to some trigger factors. Trigger factors might be different, internal trigger, external, chemical agents, trauma, smoking, or activation of HLA gene, and they might, after when this type of cells which is responsible for immune system activate, of course, always activate inflamed cells, cytokines, macrophages, interleukins, and due to this activation, there will be activation of growth factors production, which will come to fibrosis. In this area, there will be high activation of extracellular matrix, fibronectin, glycosaminoglycan, and third, this collagen. Or the other way, or which become to fibrosis, might be due to ischemic process. If a patient with genetic predisposition due to some trigger factors, due to cold, due to stress, have chronic endothelial cell injury, there might be chronic ischemic tissue injury, which become to chronic tissue repair, because if there will be chronic ischemic tissue, there might be again start work different type of cells which responsible for new growth, and they will be again and again tissue repairing again and again, which become one day to fibrosis. But even there will be primary ischemic cause. You should remember that this patient also has some genetic predisposition. That's why even it will be immunological or primary ischemic, you should first of all say that in both there will be genetic predisposition present. That's why you should understand why patient with systemic scleroderma, mainly which work in a specific place like factory where work with chemical agents, because they also have trigger factors. Their skin connected with this type of the specific products like silica dust, I already said, etc. And when they connected with this type of the chemical agents, their skin damaged, its injuries, there will be ischemic process because vessels affected. In this way, you can tell that there is chronic ischemic process might be reason, but don't forget that they also have some genetic predisposition. Okay. And as usual, classification of this disease, we have two big types. First, called diffuse cutaneous systemic sclerosis, and second, called limited cutaneous systemic sclerosis, diffuse form and limited form. Now, pay attention, students. We have other types, diffuse, limited. Diffuse and limited, it's big classification, but except this, we have also visceral form, overlap form, when systemic scleroderma combined with other type of rheumatological disease, and always you have juvenile form till 16 years old. Rheumatological disease, if affected child called juvenile form. Diffuse form. What about diffuse form? Okay. First of all, look at this. In this picture, in diffuse form, patient with systemic scleroderma affected skin of patient affected 100%, all part of body affected by the fibrosis. In a limited form, distal part affected. It means this part, elbow and down, knee and down, and neck also might be affected, neck and face. Students always confused. They think that distal part, this part. No, this part called proximal and distal, this part of the extremities which are more far from the center trunk called distal, and this region of extremities called distal part. Now, diffuse form affected all body skin. It means proximal skin also, proximal, because proximal, if affected proximal, already it's diffuse. Trunk, face, all part. And there will be rapid progression of skin change, it starts rapidly. And except this, there will be early involving of internal organs fibrosis and bad prognostic factors. How you can differentiate it's diffuse or proximal? You should check proximal part of the body. In this part, if you found change of the skin, you should understand that it is this diffuse form. In limited form, they will be affecting mainly distal part of the skin. I already showed this picture. And strong glass shade with crest syndrome. Crest syndrome, we will discuss what it means, crest syndrome later. And good prognostic factor, then of course diffuse form. Internal organs involved, but later. In diffuse form, there will be early involving of internal organs. About third form, it's called visceral form. Visceral form characterized by the damaging of the affecting of the internal organs without skin damaging. And overlap, you already know, combined with other diseases and juvenile when affected child. Now look here, it's up later. Now let's start about clinical manifestation. First, we will discuss about Raynaud's phenomenon. What is Raynaud's phenomenon? Before I already said about Raynaud's phenomenon, a little bit when we will discuss SLE and dermatomyositis. If you remember, students, Raynaud's phenomenon is rapid vasoconstriction of small vessels and might be triggered by stress, cold, mainly stress and cold, reason of the Raynaud's phenomenon. Raynaud's phenomenon or syndrome, same students. Due to this thing, patients have rapid vasoconstriction, and in clinical manifestation, you can found cold hands and feet with color changes, white to blue to red. It will be different color, white to blue to red. Okay, and Raynaud's phenomenon, of course, specific might be present in different diseases in dermatology, but more specific for systemic scleroderma. Now look here, Raynaud's phenomenon look like this: white, blue to red, white, little bit sad here, blue, and to red. Here, little bit partly white, here blue color, and some part already red. Why this type of color will be specific for Raynaud's phenomenon? Because white when start vasoconstriction and hands or feet feel less of oxygen, there not enough oxygen, that's why it will be white color. Later when they start some ischemic process, because if there will be long time no oxygen, of course tissue feel ischemia, and that's why there will be blue color, oxygen less in this time. And when again there will be reoxygenation, when vessel come to normal, vasoconstriction stop, there will be normal oxygen, normal blood present here, normal count of blood here already, and that's why it will be again red. And later it will be normal hands again, normal color of hands like this, yes. Sometimes in rheumatological patient, Raynaud's phenomenon will be without some specific disease for long time, just Raynaud's phenomenon. Yeah, it might be possible, students. Skin, Raynaud's phenomenon. Next, skin. I said that mainly a problem of patient with systemic scleroderma is skin changes because fibrosis, due to fibrosis of skin. Due to fibrosis, patients have clinical manifestation of skin, but this clinical manifestation will be different because we have different phases, different phase of the skin changes. We have 3 phases. They called edematosus, indurative, and atrophic phases. Students, they will be one student's left lecture. What happened in each phases? First phase called edematosus phase. Patient fingers will be look like sausage finger due to edema. But students, how we should differentiate edema due to what this edema? The edema might be due to different reasons, due to different disease. For example, if there will be edema due to a kidney problem, mainly your patient and you notice that edema starts from the face. Until the eyes, we can find that there's edema, and also there will be edema of the lower extremities, first of all. If there will be edema due to heart problems, also there will be edema in lower extremities, but in evening time. For kidney, it will be early morning time. And now, what about edema of systemic scleroderma? Edema of systemic scleroderma patient mainly affected fingers, and called sausage feet, look like sausage fingers, and also this edema due to poor lymphatic return. Why? Because problems with vessels, that they already have fibrosis of small arteries. That's why they will be bad returning working between lymph vessels, between vein vessels and arterial vessels. And also there, of course, will be inflammation, which might cause a little bit of edema sometimes. Next, it's about second stage, which called indurative phase. Indurative phase characterized by the induration. What means induration? It's thick, shiny, tall, cannot be easily picked up like this. It will be hard to pick it up patient or skin. And sometimes you can found in patient regionally hyper and hypopigmentation area of skin, hair loss, and decreased sweating. Why? Because not normal working of vessels, and due to this affected all part of the skin function and sweating also. Okay, come back for this slide. Now look here. In this slide, when patient showed his hand, he can't flex his hand because due to fibrosis happen induration, and also shiny color skin. Hair loss also was here. Look here, hair loss. Hair loss, if you remember, in dermatomyositis also linear variety like this line, it will be hair loss like line, not alopecia. Alopecia is diffuse loss, which is specific for SLE. Here will be like one line. And about skin, when happen fibrosis, real fibrosis already happened, they will be like also one line mainly. That's why line variety is specific for systemic scleroderma disease patient. If you will be attention, here also linear variety in this region. Okay, this is about second stage. And phase and third phase, it's called necrotic phase or atrophic phase. When patient had a long-term ischemic process due to fibrosis of small vessels, they start in this organ start some necrotic process because long-term ischemia become to necrosis. You know about this necrosis, no atrophy, same synonyms, yes. And what happened with patient fingers? Mainly, not mainly, affected distal part. There will be a dry gangrene, and look here, this patient hands, they happen cutting. They got cutting by themselves without surgical cutting. I remember patient when I was with students in the dermatology department. There was a young woman without one finger, and she said, I woke up early and found that she said that before there was clinical manifestation like this, there was gangrene, ischemia, and once she woke up without a distal part of finger because it's cutting without surgical cutting, without something extra, they just cutting. I think it's a very dangerous situation when you the day by the day you found that your fingers, you lost your finger. Yes, it's very dangerous picture. It's final stage atrophic. About this stage atrophic phase, atrophic phase might affect also nose, ears, because it's also a distal part of the body. And we know distal part affected first of all because there is ischemia, there is low oxygen. That's why there will be atrophy of the distal part first of all. Next, change of skin, except this phase, which will be affected patient skin step by step. Except this, you can find ulceration. Why there will be ulceration? Because atrophy, because long-term ischemia. Pigmentation, there will be a dysfunction of the melanin due to not normal working of the different function of tissue. It means about skin, and there will be depigmentation or hyperpigmentation. And I want to show this picture like this. This patient has hyper and hypopigmentation. There's hyper. For example, in this hand, there's hypo, a little bit whitish. Here also hyper and hypopigmentation. Here also hyperpigmentation. Here hyperpigmentation. In this region, whitish color, it means hypopigmentation. These symptoms called salt and pepper symptom because salt like white and pepper like black. Salt and pepper symptom. Students, remember about this. Calcific deposition. Calcific deposition will be look like this. Here, it's look like nodules. Yes, we found nodules in rheumatoid arthritis. Sometimes mistakenly gout arthritis. Those might be mistakenly found like nodules, but you can differentiate by the X-ray. By X-ray, you can find calcification like this. Here also calcification. Okay, capillary changes. Okay, about capillary changes. Capillary changes, telangiectasia. Uh, due to that, they lost normal function of small arterial and vessels, vein vessels, for example, but mainly about arterioles here. There will be symptoms, telangiectasia, or the symptoms also called small stars. Small stars because when these vessels affected, they damage and a little bit blood go outside, and that's why in clinical manifestation we can find a little bit reddish, like pink color rash without itching, without surface touching, just smooth rash called telangiectasia. Telangiectasia you can find everywhere. You can find also in mucous part of here also present telangiectasia. Big changes which are specific for systemic scleroderma. Telangiectasia you should differentiate if you will be pediatrician doctor. I guess you should differentiate with some vasculitis, because for different type of vasculitis also mistakenly you can think that it's type of vasculitis. It's also vasculitis, of course, inflammation of the small vessels, but these are the disease. Okay, and what happened later is skin. Later, due to long-term fibrosis, there will be acrosclerosis. I already said acrodistal part affected first of all, and due to this there will be contractures. Contractures when patient can't flex his hands, mainly about hands like this, because due to acrosclerosis, there will be fibrosis of skin, and patient can't flex like this his hand. The patient hands will be in one position like this. In this hand called spider hands symptom, because spiders look like this. Spider hands symptoms. Remember about this. You also can find surround mouse. You can find a lot of the wrinkle, circular wrinkle. So surround the mouse will be wrinkles, and also due to fibrosis, lips become too small and like one line. It's also specific change of lips of patient with systemic scleroderma. For example, look like this. Look at this picture. Look her mouth also. Pursed lips, it's called. The lips look like one small line because fibrosis decrease volume of lips. Pinched nose will be here. And immobile face. Immobile, it will be amimical, no motion face. Why? Because patient can cry, smile, cry, be angry. It's specific tests when you check patient. For example, in rheumatology, to check joints, you take one hand, surround the joints, and by the second hand, flex these joints like this. For patient with systemic scleroderma, you should ask to smile, to be angry, to cry like this. Simple test, and patient can do motion of his face. Because fibrosis, due to fibrosis. And look, remember this face, students, and look here, this face. Again, pinched nose, lips, pursed lips, and immobile face. In common, if patient has long time systemic scleroderma with acral sclerosis, face of patient with systemic scleroderma will be little bit look like due to specific symptoms. Again, look here, this lips again, these lips, they all look like little bit. It's about skin change, students. It was about skin change. Now, about as usual, first mainly general changes, and then other symptoms. Now about musculoskeletal. About musculoskeletal, there will be arthralgia, morning stiffness, no problem. But morning stiffness not look like rheumatoid arthritis stiffness. In rheumatoid arthritis, your patients say, I feel morning stiffness more than 1 hour. It will be decrease after some motions like this. Here, morning stiffness will be not more than 50-20 minutes. Arthralgia patient feel pain also. Erosive arthropathy might be found by you in 30% of patients. But if patient comes with pain, first symptoms of disease, since systemic scleroderma will be pain, you should ask about symmetrical or not, which joints affected, about X-ray finding. Yes, if you attentional ask, of course, you can differentiate by the rheumatoid arthritis. It will be easy for you. And of course, you will be found calcinosis. In rheumatoid arthritis, there is no calcinosis, there is nodules, if you remember. That's why it's necessary to know for each disease, each specific moments, you should check and ask your patients, students. Okay, students, are you here?
Yes, ma'am.
Show me your hands, just how many students here. I want to check